a splint to mobilize the middle finger PIP joint into extension, and we're going to do a hand-based splint. So the pattern looks like this. It's going to fit on the, let's see, the right, I'll show it on the right hand, but then I'm going to make it on the left hand. So, no, never mind. Yeah. So this one is going to go, no, where am I here? No. Okay. So this is going to go in between the finger, and this is going to sit dorsal, and then I'll attach my outrigger there. But I'm going to make this on the other hand, I think. So I have to flip it that way. So I'm just tracing with the grease pencil. The material that I'm using here is that Nano Splint Wisconsin material, and it's a 3/32 thickness, I believe. It's over here. When you're cutting the splint material, it's easiest if you hold it in your hand, sort of drape it in your other hand, open the scissors wide, and take as long strokes so that minimizes the choppiness on the edge. I'm going to save this for my outrigger. And it's easier to turn the splint material than to try to rotate the scissors around. And that's another reason why it helps to hold that splint material in your hand. So I'm going to place it, tattoo one, and then this is going to go between the web space of the middle and ring finger and wrap into the palm of the hand. Okay. And when I'm mobilizing the PIP joint into extension, it's probably not a bad idea to put just a little bit of bend at the MP joint, just to help to secure the splint in place. I don't really have to worry about cutting below the PIP on the volar side because I'm moving this way, right? So I'm not going to be coming into flexion. But I do want to make sure that the dorsal surface is straight across the PIP joint and is rolled so that when I'm coming up, it's not a hard edge. So that rolling that edge is going to make it more comfortable. Meanwhile, while that's hardening, I'm going to get my cuff prepared. And I'm gonna make a closed design cuff, which means that I take the line and I put both ends of the line through both holes, and then I loop it back through itself so I don't have to tie knots, and so that's going to be my cuff. And when I pull, I want the middle of the cuff to be right at the middle of the distal phalanx joint line. If I go this far, then I'll be stretching the DIP joint, and I don't want to do that. So it should be right at the middle of the cuff, at the middle of the joint line. That allows me to stretch the PIP without stretching the DIP. And of course, she's got a contracture, so she's going to be down there. And I'll be pulling up from there. Okay, so I want to just go ahead and trim this a little bit. And I'm also going to add some strapping so that this is stable, so when I attach my outrigger, I've got a stable base. Meanwhile, I'm going to go on ahead and heat up a piece of splint material because I'm making my outrigger out of splint material. I'm going to get some Velcro hook here for my straps, and when you attach the straps to the splint base, of course you always want to heat the strap using a needle nose plier to hold it over the heat gun, and that's going to make a permanent bond. But I'm not going to do that for all of these straps. Okay, so now we have a little problem because I have to attach straps to this piece of thermoplastic, but it's very narrow. And so if I put Velcro there, it'll be hard for me to get two straps in place. And so what I'm going to do is I'm going to rivet the straps. So if I were in the clinic, I would use a metal rivet, which I would secure both straps to, and you use a hammer and an anvil to do that. But I'm going to make a thermoplastic rivet today. So what I do is I punch a hole into the thermoplastic. I'm going to have two straps, one going off this way and one going off that way. So I'm going to punch a hole in each of these straps, which is sometimes a bit of a challenge. Oh, I got it. Okay, meanwhile, my outrigger is getting soft here. So I'm going to just get this out and make my outrigger. So to make an outrigger, you want splint material that's double the width of the outrigger you want, and fold that. So that fold quadruples the strength of that outrigger. Now, of course, I could purchase and use a prefabricated metal outrigger. That's perfectly acceptable. But to save money, or if you don't have, you just use your last one, and you need to make a splint for a patient, you can always make your outrigger out of thermoplastic. And again, I'm going to go ahead and punch a hole here. Although sometimes it's better to wait till it hardens, but I did. I got my hole. So now I'm going to make that metal rivet. So the way that we do this is you get a little piece of thermoplastic that's got a kind of a skinny, sharp point. Okay? Line up your Velcro with the hole in the splint and kind of put those straps at the angle that they're going to attach down to. Okay, so that's showing the little plastic poking through there. So I know everything is lined up. So now I'm going to take that little piece of thermoplastic and I'm going to hold it over the heat gun until it softens up. And you start kind of seeing it bend a little bit, so we know it's soft. You just take it and you shove it through that hole and press. And it should come through on the other side. And then just rip it off there. And if you didn't get it quite through all the way, you can come from the opposite side. And this time you don't need as sharp of a point, and just coming from the bottom and pushing it up. So now that rivet is in place. Okay? So I'm going to go ahead and put that on your hand. And I will also secure with the Velcro and at the wrist. So that's stable. And again, I would normally heat seal that. Okay, so now the splint is solid. I will eventually put a strap between the dorsal and volar piece to secure that middle finger, but I don't want to put it on yet because I have to attach my outrigger there. So now it's the time to attach my outrigger. So the first thing I'm going to do is, again, look at my line of pull. So I know my outrigger is going to have to meet this line to create my line of pull. So I have to come from here out to there. All right, so I'm just kind of getting that plan in my mind. So the first thing I'm going to do is put the line through the hole in the outrigger. All right, and then I'm going to pull, make sure that line is pulling in the proper position, middle of the distal phalanx, at a 90 degree to the middle phalanx. So that looks perfect. So now I'm going to ask my patient to please hold that line. And of course she's got an end range, you know, so she'll pull and she can maintain that. So I make sure that that line goes through the hole in the outrigger. I attach the outrigger to the splint. And, you know, get it down as good as you can. You're going to go back to heat that with the heat gun as soon as the line is formed, but I'm just getting that attached for right now. Now I can come back, make sure that the hole is going, or the line is going right through the middle of the hole. And I can also increase the strength of this outrigger by pinching down here. That adds a little bit more contour to the outrigger, and that's going to strengthen it. Also notice there's a little curve in the outrigger as it goes from the end of the splint to the line, and that curve here also adds strength. So this outrigger, when it hardens, should be nice and strong. Sometimes when I make the outrigger, I will punch, you know, another couple of holes so that as her finger comes into more extension, I can move the line back through those holes to maintain the 90-degree line of pull. Okay, just go ahead and relax for a minute. So that's going to harden here in a minute. Sometimes you could use a spray bottle of ice water to just get that to set up a little bit more quickly, because that's one of the challenges, is just waiting for that to harden, right? So let's go ahead and take this off. And I may lose a little bit right now, but we'll just hope that it stays good enough we can illustrate what's going on here. But now I'm going to show you how to seal this down to the splint base. So normally what I do is I literally pick up the heat gun and hold it very close, and we already lost our outrigger. But maybe I can heat the bottom side of this. And it should kind of go where it was. All right, so I'm going to just basically pick up the heat gun, heat that. I've got a little glass of water here. Dip my thumb in the water and seal that down. Okay, do the same thing on this side. Heat it up, dip my thumb in the water, and seal that down. Lost my line a little bit, so I'm going to go ahead and put it back on our hand. And this got soft again, so we just kind of repeat the process. But I know it's going to be close, I'll be able to reestablish that line because I put that in the same place. So again, give her a contracture, pull up, and then just hold that until it hardens. And now with that heat sealed in place, that should make a permanent bond. So at this point, I should be able to put my Velcro around the finger. Sometimes when I go through the finger, I'll use a narrower strap or even cut out a little groove for the web space. So this is going to go in here. All right, now I have a couple of choices. I can make this either static progressive or dynamic. So if I'm doing static progressive, it doesn't really matter if the line drags along the outrigger, because once we establish the strength of the pull, that friction isn't going to make any difference. So static progressive is probably the easiest. So I'm going to just tie a knot at the end of the line, just like a knot you tie on the end of a sewing thread. So for static progressive, I often use just Velcro hook and loop. So here's my knot. So my Velcro hook is going to go kind of at the end of that knot, down the back of the splint. And then my Velcro loop, I'm going to punch a hole in that. Place the line through that hole. Open up the line thread that Velcro back through, and now that's attached, so I don't have to tie knots. So again, this isn't really holding quite strongly yet, but so that's my static progressive for PIP extension. If I wanted to do dynamic, I'm going to need to do I'm going to need to add a guide to prevent that line from dragging on the splint. So I probably should have done that before I put this in place. Maybe I can take this off real quick so we can see how that goes. I don't know how to reverse that process. I'll try it once. If not, I'm going to just cut the knot. Yep. Okay. So the way that we make a line guide is you take a paper or safety pin and you bend the end of the head down. So this is going to sit here and the line will go through that. That may be a little higher than it needs to be, but it's fine. So I would take that paper or safety pin, and I think I'm going to have you take it off, just so I don't burn you. And I'm heating the safety pin over the heat gun. I could have probably used a smaller safety pin. This is pretty tall, but you'll get the idea. And then I just kind of sink it into the thermoplastic behind the hole. And then I'll just take another little piece of thermoplastic, heat it up, and run it over the top of that to secure that in place. The other thing with the dynamic is I'm going to need an anchor. And so I'm going to show you one technique for making an anchor. Again, I need another little piece of thermoplastic, so I'm going to heat that up. This should be soft by now. And I probably would also do a little dry heat, because the dry heat is going to be stickier than wet heat. And I'm just going to place that over the safety pin, and that's going to help to secure that in place. And now the anchor. So normally when I make an anchor of thermoplastic, I kind of cut the thermoplastic into what I call a teardrop shape. And then that narrow end, I am going to roll it and form it into a hook. And this part is going to go on the edge of the splint and then wrap underneath, so that when you pull, it's pulling up. It's less likely to come off if you do that little extension on the undersurface. And then of course I want to heat seal that in place. So again, almost right on the splint material, use your thumb with the water to protect your, now I use my index finger. So that's going to just seal that in place, and on this surface as well. Okay. And then I make my little hook, which will take a couple minutes to harden. So meanwhile, I'm going to run up through here and through the hole in the safety pin. And then I'm going to attach a rubber band. And the selection of rubber band, you know, it's kind of a trial and error thing. Depending upon, you know, how tight the tissues are, how large the joint is. This is probably a pretty hefty rubber band for what we're using it for, but that's okay. So go ahead and go in there. Strap around the rest. And the strap around the finger. Where'd that go? Here it is. The cuff on the finger. Okay, hold your finger down there now. And then, okay, and then hook. Now, okay, look at here. So we're still dragging there. You see that? So we would, what I would probably do is, instead of putting the hook down here, it seems that it would be better. And the reason that's happening is because of the MP flexion. But we like the MP flexion because it kind of stabilizes the splint in place. So I would probably be better to put a hook from here up to there. See how that would solve that problem? So that would be for dynamic. So again, you could do either static, progressive, or dynamic. If you wanted to do both, you could attach that Velcro, but then you'd need a longer piece of Velcro because my hook is down here. I'd have my hook up here. And it really doesn't matter. I mean, the hook can be a little off-centered even if it's not in perfect alignment, because the line of pull is actually established here. You know, so even if I pull over here, it's not going to change that line of pull. And the reason you don't want this dragging is with dynamic is that you lose the force of that dynamic tension if it's dragging on the splint. How's that feel?
Good.
That's okay. All right.
Stop.
Mm-hmm.